I'll let you know. You'll probably see it anyway.
Says it's
okay, so we are live now, and we'll just wait a moment for anybody who's there to join us.
It's strange on Facebook compared to Zoom, or StreamYard compared to Zoom, in that you're the opposite way around.
Yes, it is weird. And then when you go one way, it's the opposite, isn't it?
Yeah, that's what, because when I teach yoga, I'm used to mirroring out on Zoom, and actually here you don't have to.
No, quite. No, it took me a while to get used to this. The whole what you see is so different.
Yeah.
So Susie's joined us. Hello, Susie. I think we've got somebody else as well.
Hi, Susie.
And hopefully we'll just let a few more people join. So whereabouts are you based, Lyndsey? Where do you live?
I mean, very close to Reading.
Reading, okay.
In the south.
So did you get all the rain and the winds, the storm that they had up north? I wasn't up north at the time, actually, but no?
Yeah, we didn't really. It wasn't that bad. I mean, it was a bit windy, but we had a bit of rain, but nothing more than like a normal bad weather day. We've been lucky, actually. We had a sprinkling of snow the other day, but we've not had much yet. Yeah.
Oh, that's good. Well, I was actually in Devon at the time, so I missed it all. So
you missed it,
there was quite a bit of snow here and very, very cold. Actually, it is cold today as well, but so very, very close to you. Oh, Reading is very close to you. Is that right, Susie?
Ah, where are you, Susie?
So who else? Yeah, I can't remember, Susie. Whereabouts are you? And who else is here? Come on, join us and say hello, and then it feels more like that we are talking to people rather than just together.
General chit chat. Although I forgot to go and get my cup of tea, so I should have got that.
Is it there? Is it hot?
No, I forgot.
No,
I forgot to go and get it.
Would you like to get a cup of tea before you start?
No. Oh, Lambourne.
Oh, that was it, Lambourne.
I didn't know where Lambourne is. Hello, Lorna. Hi.
So hello there, Lorna. All right. So Susie, you had lots of snow. Wow. Okay, and we've got Irily here as well, so that's good.
Irily. Hiya.
Okay, so do you want to start, Lyndsey? I mean, this is here for. There you go. So this is in West Berkshire, and there you are. Caroline's from Reading as well.
Hi, Caroline.
So, if any of you've got any questions that you want to ask, then, as you know, just put them in the comments box there, and we will at some point answer the questions. But to get started then, Lyndsey, do you want to just tell everybody a bit about yourself and maybe how you got into this work, your reasons to get into this work? Because I know that played a part, didn't it? Your personal reasons, yeah?
Yeah. I'm just seeing a
comment. Hello, Maggie, as well.
Hello, Liz. Comment from Liz.
She's Liz on Facebook.
Liz. Okay, that's confusing. Yeah. So for those people who don't know me, and I know some of the people here, but not everybody. So my day job, so to speak, is I work as a yoga teacher, and specifically I work teaching Yin yoga and Qigong as well, and then I do a range of meditation and breathwork teaching as well. So I teach kind of a range of things, and then the area that I particularly specialize in is helping people with back pain. So I teach a specific movement for back pain lesson every week, and I have a specific movement for back pain course. I have a sort of recovery course for people with back pain as well, and I got into this work because I originally had chronic back pain myself through much of my 20s and 30s, and only really have been what I call completely recovered for the last 5 years. And because for me, I found that yoga was a big part of my recovery, I wanted to be able to help other people with chronic back pain to recover as well. And so it's how I ended up sort of specializing down this route. And then through a lot of the work I was doing with yoga, I found that a lot of the issues that people had, whether it was back pain or other chronic pain conditions, had a lot of linkage to stress. And I actually found out about SIRPA through my friend Caroline, who's here today, because her husband also had chronic back pain, and we came to be talking, and she asked me if I knew about the work of SIRPA, and I hadn't actually heard of it. And then when I started to look into it, I kind of found there was just like remarkable similarities between the work that I've been doing, working with people through gentle movement practices, breathwork practices, dealing with stress, dealing with sort of slightly wider issues than just movement, and how that was helping people to recover from their back pain. And then when I looked into your book, Georgie, and found out about what SIRPA was doing, I kind of had this like massive light bulb moment that this links really well, and it's hugely complementary to what I do. So that's when I did my SIRPA training last year. Mm-hmm. And I've been doing my work through case studies to become a SIRPA practitioner as well.
Excellent. So through your own, this often happens, doesn't it? Through people's own personal journey, they find this sort of approach, this concept, this understanding and approach, and then often want to start training in it as well. And we've had quite a few people who aren't health professionals or yoga teachers or coaches, and they actually want to then find a way to get in to be able to do the training. And that often is through coaching courses, etc. So presumably then this is just integrated. You found it really easy to integrate this approach into the work that you're already doing. It works really well. So I've got a kind of big group of people that regularly come and practice yoga with me, and then I'm kind of increasing that group of people specifically into this group of people with chronic back pain. And I've been working, so at the start of the year this year, I actually ran quite a decent sized trial with people with chronic back pain to incorporate all the different methods of my movement side of my practice, the breath work, the meditation, and then quite a few of the SIRPA tools as well. So I started to introduce some of the tools around journaling, some of the tools around mindset, so working more with reframing thoughts, looking at how we think about our pain a lot more, and doing quite a bit more research into the work that the curable clinicians have been doing as well, which obviously SIRPA's linked into, and just kind of trying to bring it all together into a more holistic approach for people. And so I've been having quite a good success with that, in terms of people saying that it's made quite a big difference to their pain. And it's been I think one of the things that's most surprising is how it started to make me rethink about how I thought about pain as well, because it's, as somebody who always used to have chronic back pain for a really long period of time, even though I've actually been pain-free for quite a lot of years, I still, in my own mindset, saw myself as someone with back pain or a back pain sufferer. And actually doing this work has actually led me to go, actually, I don't have back pain. And it's made me change quite significantly how I talk about pain myself, and how my interactions with other people about pain change. Because what I found is that when you've got chronic pain, people who are close to you, friends, family, people who really care about you, they actually talk to you about your pain quite a lot all the time. And even now, even though I don't have any pain, I can just go to pick up something heavy, like one of my dogs, and I pick the dog up, and people go, "Oh, what's your back?" Yes.
Oh, that's fine. I don't have a back problem. And then, oh, you need to be careful with your back. And you're like, no, I don't actually. I'm fine. My back's really strong. I'm really comfortable with doing this. And so it's a re-education process for yourself. And then there's also a re-education process for lots of other people who've always been looking out for you. And then you've got to kind of say, actually, I'm fine. I'm okay. Yeah.
Absolutely true. Yes. Like you say, you're not just re-educating yourself, but people around you. I know Marie, who spoke at our first conference actually about her recovery, she mentions that as well, and about and her always spending her time even saying to her kids, be careful of your back, don't do that, and then having to really reframe the way she was talking to her kids once she was better, and realizing that she was reinforcing the wrong beliefs to them about pain and their backs. So it really is about changing our beliefs, our understanding, the way we think about it, the way we talk about it. the way we move. And it can be challenging, can't it, when we're surrounded by people who are saying, be careful about where you lift, or going, organizations constantly doing, annual manual handling training, despite the fact that there's no evidence showing that there's any benefit at all with lifting a certain way or being careful or whatever. And so it can be quite difficult, frustrating, if you're being surrounded by people who are talking like that, and we have to just be careful, because there's no way they're going to suddenly stop all these trainings and everything. But yes, it's re-education, changing beliefs, and that's challenging. And if people have beliefs, as we know, you can't just change somebody's beliefs. They have to be ready for their beliefs to change.
Yeah, and how I teach yoga in particular, I have to be really mindful of the language that I use, because again, historically, when I was teaching yoga, before I started to perhaps incorporate a lot more of the mindset work and the things that I've discovered, particularly through a lot of the work that Peter O'Sullivan, the Australian physiotherapist, has done, where he talks a lot about the language that you use around, watch your back, mind your back, be careful, do this, and actually. So one of the things when I'm teaching yoga, particularly because I teach people who have back pain or back problems, is to not overemphasize that. And, so you have to be really mindful of saying, just see how your back feels. Or, we need to be mindful of our backs in this position, but not actually making people worry that, this position could hurt like that. So it's quite interesting. And then a lot of what's traditionally been taught in, whether it's Pilates practices or yoga practices or other sort of movement practices, have been very precautionary about people's backs. So there'll be the whole, engage the core and, do this, bend the knees, fold with a flat back. And it's stuff that I actually used to teach. And now I actually teach quite differently, because it's like, it's fine to move the back. In fact, we've got to move the back, because if we don't move the back, it's going to become stiff and seize up. And it's exactly what had happened to me before I started to incorporate a regular movement practice into my life, was you become completely rigid and fearful. It's this fear for a lot of people with chronic pain, whether it's back pain or other pain. You become really fearful of moving at all, and then it becomes a downward vicious circle of not moving, becoming more fearful, and so on. So re-educating people about it being okay to move, and it being completely safe as long as we do it gently and we listen to what our body says, has been kind of a really big part of my teaching and my own practice over the last few years.
That's really good to hear. Just before I move on, if anybody's got any questions, don't forget, do put them in the comments box. Otherwise, we'll just keep carry on chatting. But that is good to hear, because so often we have to be careful, about people who are wanting to go to Pilates, yoga, anything like that. And it's about it being so important to move and so important to get over your fears, but not to be seeing somebody who's saying, be careful, if you've got a back problem, you must be careful because of this or whatever, constantly focusing on whatever they've been told that person has an issue with. If you've got a back problem, you must be careful doing this. And even when I go to the Commander Fit classes, and at the beginning of every session, has anybody got a problem area? Anybody need to be careful? And that's, be careful doing this. And I'm going, oh no, please, you're just reinforcing it.
Yeah, well, you have to do that from your own personal insurance perspective, don't you?
Absolutely, yeah.
As the teacher, you have to be responsible, because some people's injuries do actually require them to be more, if it's more of an acute injury, obviously, for somebody to be mindful of what they're doing. But with the chronic conditions, it's very rare that, particularly if someone's in a very gentle movement practice, and the advice I give to people who want to start a movement practice is, it probably doesn't make sense to go out and start doing 3 times a week Ashtanga yoga, which is a very dynamic form of yoga, and it moves quickly from one position to another, because the chances are you probably will injure yourself somehow. You'll probably acquire an acute injury. Whereas if you start with something very gentle, like a yin yoga, where you start very slowly, you stay in postures for long periods of time, and you you're kind of very mindful about what you're doing, and it can be more of a meditative, stress releasing practice. You just get used to doing some very small things, and then you can build up over time. And so again, it's about, you know, trying to get people to be not scared of doing anything, but making sure they don't go off and do things that are completely inappropriate for where they are in their kind of current stage of...
Yes, because I think the other thing is, if there's chronic pain, then there will be tension as well. And if you're going to then push yourself into something that is extreme, even if you don't injure yourself, the fear related to that will cause more tension and probably pain. So, you know, they have to do something quite extreme to really injure themselves. But absolutely, I would agree that they would get pain. But a lot of that would also be to do with the tension and the fear related to moving. And so I think it sounds like the yin yoga is a nice gentle in there to be, like you say, being mindful in the moment and gently and self-soothing. If you're doing meditation, you're doing yoga, the breathing, you're teaching people to self-soothe, which is as well also going to calm down any tension.
Yeah.
Right. So Susie says, do you only work with pain-related TMS?
Not necessarily. I think, you know, often, well, it's kind of one of these things, isn't it? Because people initially come to you with pain, and often people haven't necessarily related it to TMS or PDD. They're kind of, I've just got this pain or back pain and I need to work on it. And then actually when you start to work with people, you do uncover that a lot of it is related to other issues. You know, it's not the reason for the pain isn't what their original cause of the pain, if there was one, was. So, you know, I work with all sorts of people, but I think ultimately when you get to know them and you find out why the people with chronic pain, why the pain's there in the first, you know, why that pain continues, it's usually because they do have a broader kind of stress related, emotional related series of conditions or, you know, issues that need to be resolved. And also, you know, they've had a pain pathway that's been there for a really long time, and I think that we have to work on resetting that. And that's where I work quite strongly with breathwork practices, because I think breathwork is something I've been teaching for quite a lot of years now, with a very good degree of success with people in terms of resetting the nervous system, essentially. And so again, prior to really even being involved in SIRPA, I was working with people who have a whole range of issues, whether it's anxiety or whether it's chronic pain condition, and finding that the breathwork practices are fundamental in kind of addressing that.
So what I was going to say, and you've mentioned there you worked with people with anxiety, was rather than just pain, because as Susie mentioned, I think what you were meaning, Susie, presumably is, do you only work with pain-related TMS, but do you work with other TMS symptoms as well? That may be weakness and any other symptoms?
Potentially. I mean, I just think it's any... I mean, do you mean aside from back pain, or do you?
Yes, I mean, I know your focus is mainly back pain, isn't it? But I think what Susie's asking is if you do you work with people who have other symptoms of TMS, maybe different sensations or a weakness rather than a tension or pain or whatever. So other symptoms, if not back related. Limbs or even weakness in the back.
Yeah, I've had a few students with that. I actually had a few students with quite a lot of issues around a recent student actually around dropped foot is something that we've been working on, which has been caused through surgery with a nerve issue. And I don't think the dropped foot is something that we can work on specifically with some of the tools I've got, but I think what I'm working with that student on, for example, is working around just getting confidence around starting to move again, using balancing weight between the feet and getting used to being able to move that foot. And it's not necessarily TMS related. It's kind of, that's more of a surgical thing, and that kind of links more into my skills, I suppose, as a yoga teacher rather than necessarily as a SIRPA trained person. So yeah, I do get quite a lot of different people come. I worked a few years ago with somebody who had a collapsed lung and had a whole series of issues around his ability to breathe at all, and we did a lot of breathwork practices which significantly improved his ability to breathe, and then actually start a movement practice. And interestingly, with him, the lack of ability to breathe properly had sort of had a massive impact on his life. So he had a lot of depression and a lot of other symptoms that were related because it had such a big impact. And through working on the breathing and improving that, and then starting to do movement practice, actually able to improve all those other things as well. So he had a whole range of conditions which came from one issue.
Yes. Yeah, absolutely. So yeah, so obviously you are working with various different symptoms people present with, and as Susie points out, yes, drop foot can be TMS, and we're assuming then that this person, if the nerve was actually cut, damaged, then yes, that could cause drop foot. But if it had just been, there are different injuries to the nerve anyway. Maybe if they'd been bruising, the chances are it would have recovered. But yes, their drop foot can be TMS as well.
Yeah, I mean, this lady, she actually had an operation recently to remove a tumour in her pelvis, around the pelvis area, and one of the complications has been a damage to the nerve, which has caused this drop foot, and then she's also got a lymphedema issue as well.
Oh dear. Yes.
So there's a whole range of complications which I don't at the minute think are PPD or TMS. It's possible that they could prolong because of stress around it subsequently. I mean, I don't
absolutely know. Because what I was going to say is that what I love about this work is that whatever condition we have, this approach can still help. So the fact that somebody has had cancer, we're not saying we can cure cancer, but certainly by working on their stress and worries and anxieties around that, absolutely, it could help, and sometimes help people recover more quickly as well. But, okay, so Maggie's saying, what I've found in terms of how we see ourselves, labels can be very limiting and unhelpful. Absolutely. I've been given so many labels by doctors, whether it's IBS or SOD or migraine. You begin to see yourself as that sick person. And some people look for that because if they haven't got a diagnosis and they've been told it's medically unexplained, then they're left in confusion, not really knowing what to do. And often actually just having a label, whatever that is, can be helpful, but then, like you say, it can then end up being not so helpful. So Maggie said, I also found I was starting to give myself labels like being intolerant, unmotivated, depressed, etc., which I'm working to change as they aren't necessarily accurate. Well done, Maggie. That's absolutely true. Yeah. Just listening to the way that we're talking to ourselves is really important. And even now, occasionally, might say something like, "Oh, stupid idiot, Georgie," and I'll immediately say, "No, you're not stupid. You made a mistake," or whatever. And I will just make sure that I'm reminding myself that no, actually, that's not the case. But you're right, Maggie, in that I think many of us would say, "Oh, I'm so intolerant," or "I'm so this." And what's so lovely is that by knowing that, then you can then work on it and begin to think, okay, so maybe I'm such a procrastinator. Okay, when do I do this? Why do I do this? What can I do to improve the situation? So yeah, good point there, Maggie. So Sue Bowden says, hi, Lyndsey. What was the breathwork training that you did? Good question, Sue.
So I've done quite a lot of different breathwork training actually. So I did some through my original yoga teacher training. And in yoga teacher training, traditionally, some of the forms a lot of them are linked to longer length exhales than inhales, which traditionally have been taught to try and rebalance the nervous system, bring nervous system more into a parasympathetic state. But if you continue to practice extended exhale for too long a period, it can actually have some unintended consequences, which can, make you very sleepy. It can make you very tired and exhausted. So what I learned in just from a specific yoga perspective is actually they're helpful in short periods of time, but you don't want people to be working on them for long periods of time. So I did some subsequent sort of more scientific breathwork training, actually through the Sharla studio in South London, but with a breathwork teacher, Ben Wolf. And he works on the principles of, there's a book called The Healing Power of the Breath by Patricia and what's his name? What's the guy? Robert, somebody Brown?
I'm not sure.
Looking on my bookshelf to see if I can see it, but I can. I'll find it while Georgie's chatting and put it in the chat. But they teach specifically the coherent breath, and the coherent breath is working with a 6-second inhale and a 6-second exhale, and specifically working on doing that for around 20 minutes a day. So the coherent part is the equal length inhale and the equal length exhale. And not everybody can do a 6-second inhale and a 6-second exhale. The inhale in particular can be difficult, particularly for people with breathing problems. But you can work up to it over time. So you might work with a 4-4 ratio, like a 4-second inhale, a 4-second exhale. But the really important part is this coherence, the equal length between the inhale and the exhale. And then there's a few more principles you can add to it, visualizations of moving breath alongside it, adding in certain different breathing techniques. But the scientific research that they've done, and this links into the whole work that Stephen Porges did around vagal tone and resetting the whole body's nervous system, is that 20 minutes practice a day of coherent breathing can improve every single system within the body for the next 24 hours. So it doesn't just have an impact for the 20 minutes that you do it, it has an impact for the next 24 hours. So you can fundamentally change the cardiovascular system, the respiratory system, the nervous system. Every single system within the body can be impacted by regular practice of this. So it's quite fundamentally life-changing. And for people with chronic pain, it has the possibility to really be life-changing. And so I think it's kind of some of the most powerful work that we can do with people to teach them the coherent breathing practice.
Yeah, I agree. And generally that's what the first thing we would do is teach them to self-soothe and calm your breathing down. In fact, we've got Lorna, you're here, aren't you? Lorna Nicholson is also a specialist in breathing. And in fact, with the new online program that we've been developing, Lorna and I have been putting the first part of the treatment side is the breathing work, and looking at nasal breathing, and also looking at heart math breathing, so that is same thing, coherence again, and having that coherence between the regulating parasympathetic nervous system, and looking at balancing out coherence between the heart, the blood pressure, the breathing, and all that can be done through breath work, which I think is wonderful. And as you said, that impacts every area in the body. So Susie says, I find that if my exhale is longer than my inhale for my length of time, my heart rate increases. Why would this happen? Well, I don't necessarily, I can take a guess, but I don't necessarily know for sure around the scientific reason for that. But my guess is because you're restricting, you're not getting as much oxygen in if you're doing it for a prolonged period of time. So you're not getting as much oxygen as if you had an equal length inhale and exhale, and therefore perhaps it causes your heart to have to work harder. That's my assumption, but I don't know that for a fact. I don't know if Georgie has a view on that. Well, no, that's not what I would be expecting. And as you say, often it would be reducing at that point. So I wonder what else. But then that also might be why working with somebody one-to-one would be able to observe you breathing, and would actually be able to more easily explain what's going on. I don't know if Lorna's around who wants to chip in as well. But generally by breathing out, what we're doing is we are boosting the parasympathetic nervous system, which is why people do it before they go to sleep, for example, and encourage them to then be able to relax. Well, not necessarily.
I don't think necessarily doing anything wrong. And
No,
I think
right.
in what I've learned about breath work is that we wouldn't want to do that for really long periods of time. We might only do, say, 8 rounds of breath where we do an exhale that's twice as long as the inhale, for example. Whereas traditionally, certainly in the sort of more traditional yoga school of teaching that I learned, it was doing an extended exhale for very long periods of time. And actually, I think that's not actually that helpful. And actually working with a balanced, coherent inhale and exhale is actually much better for us. The book I recommend is this one, The Healing Power of the Breath, Richard Brown and Patricia Gerberg. It's a great book for anyone who's not read it. I really, really recommend it. It actually comes with a CD at the back with some practices to talk you through, or you can work with someone who's done training in this method like I have, and it has very good results, I guess, and they talk through lots of different cases, and they've worked with people with trauma, with PTSD. They did a whole program with war veterans they're US based, and they did a whole program with US war veterans, and have some really interesting success stories. So if people are interested more in that.
No, that's worth looking at. Thank you very much. In fact, would you mind maybe at the end just putting a link to it? Because then people, if they've not seen that bit, then they'll still know. If we just put in the comments later on, one of us will put the link in the to the book. So maybe. I'm
not sure I can. Can we write in the comments? I'm not sure I can add anything in the comments.
Yes, you should be able to, but if not, at the end on the Facebook page, or I can. Don't worry.
There we go.
Okay, thank you. But I can put the link in at the end on the Facebook page.
Yeah. I can go in at the end on Facebook. Yeah, I can do that.
So Susie was saying, I wondered if I was gulping on inhale, maybe. Again, this is where having somebody to sort of observe might be helpful. Irilee's saying a prolonged time of breathing with a long exhale would cause a stress response. So yeah, that's something else to consider. The other thing I was saying, though, if the inhale is causing that, Susie, then that's fine. Don't use that. Do the equal in and out, so that you are, which is better for you anyway. So Irilee's saying, wonderful to hear how you deliver yoga with these lovely safety messages, Lyndsey. Do you teach other yoga teachers what you've learned? And do you start your yoga sessions with your meditations, breath work, or conclude, or both?
Yeah, I don't teach other yoga teachers currently, although it's something I might do in the future.
Yeah,
maybe. And it differs. And in terms of what I teach, sometimes I start with breath work. Sometimes I start us with 6-6 breathing, for example. Sometimes we do teach other types of breathing as well. But as I say, I might teach certain types of breath for certain types of things. So I'm doing a yoga session that's focused on sleep, and we're doing what's called a yoga nidra, where we're working to bring people into a very relaxed state. I might do a different type of breathwork practice. I have a specific breath for sleep practice as well, which includes more of a visualization, and it does include, for a short period of time, a longer length exhale. So it very much depends on what I'm teaching. I'll always finish whatever I'm teaching with a relaxation, and sometimes I'll talk people through either a guided relaxation, or sometimes I'll give them some cues around the breath. So sometimes we might use some affirmations or wording around the breath, and I find I like to give people things that is easy for them to be able to do when they're on their own. So it might be something, and I try to find something that's actually like a small sentence that's perhaps about a 6-second wording. So one of the ones I use quite regularly is breathing in, I know that I am breathing in. And breathing out, I know that I am breathing out. So that people can repeat that inwardly to themselves. Breathing in, I know that I am breathing in. And breathing out, I know that I'm breathing out. And it's a really nice mindful tool for people to use in their own time. If they've only got a few minutes, they can sit and do it. Or if people are in relaxation at the end of a practice, I can guide them through it a couple of times, and then they can continue with it. If they find they get really busy with their minds and want to wander off doing other things, they can focus on that. So that works really well.
Oh, wonderful. So just I'm just thinking about now. So yeah, Lorna's saying a prolonged out breath may be causing you stress, tension. Yes, and triggering the stress response. And yes, absolutely. As we said before, try the coherence breathing. So yeah, I agree with you, Susie. Yoga Nidra is fab. What's your go-to practice if you are stressed personally in real time?
I will do some Qigong practice personally, and then I will do some 6-6 breathing, usually for about 15 to 20 minutes, depending on how much time I've got. But if I haven't got that much time, I'll do 5 minutes. Yeah. But I find personally doing some movement just to sort of get me doing something actually works very well for me. And then actually sitting, I will sit and just do a breathwork practice is actually something that works really well for me.
Yeah, I agree. That's my main go-to is breath work. As soon as I notice that I'm feeling stressed or something's triggered me. Okay, Susie says, I mean, if you're out of the world, well, breathing, you can breathe anywhere. And certainly wherever I am, I would immediately go to the breathing and just slow my breathing right down, keep it coherent and breathe nasally. So if you were out and about then, Lyndsey, and you couldn't do Qigong, would you do anything?
You'd be amazed where you can do Qigong, actually. I've been seeing my yoga students and my Qigong students that actually can do it pretty much anywhere, and people do look at you a bit odd, but it's possible. But no, I mean, often if I've got something stressful that I think, I'm worried about, or I find I'm feeling anxious about something, if I'm driving, I try and make myself more mindful. And I will have little tools whereby, if you stop at a set of traffic lights while the lights are on red, that you bring awareness to your breath for like 30 seconds or the minute that you're there. If you're traveling and you're feeling a bit stressed about something, or if you're doing a talk at work and you're feeling anxious beforehand, I would always make time to go and find a quiet spot and sit and do some breathwork practice for 5 or 10 minutes. It really makes a very big difference. But sometimes it's not possible, is it? This morning when my dog ran off in the field and couldn't come back, I'm running across the field, blowing the whistle, and it goes out the window, doesn't it? And you can't. There's not a lot you can do about it.
But even then, obviously, while you're chasing the dog, you can't do that. But even then, just knowing that hyperventilating and running around and not having any clarity is not helping us. And I remember when my cat, the first time she went outdoors and disappeared when she was, 6 months old or whatever, and she didn't come back when she was called. And my neighbor was going, oh, you're worried. And I was just kept my breathing really calm. And I thought, yeah, I'm worried, but I'm sure she'll be fine. And I was self-soothing and talking to myself all the time, keeping my breathing calm, calling to her, and moving carefully and making sure I had clarity. She came back. She came back after literally about 20 minutes. But the fact that we had 5 minutes where it was the first time she disappeared and I couldn't see where she was, that was a worry. But I was, even in that moment, aware that I've got a choice here. I can either go, where is she? I'm not going to see her again. She's going to die or whatever. Or I could just slow my breathing down. And be mindful and reassure myself. But I remember a powerful time that I used breathing for myself many years ago. And this literally was, 25 years ago. And like Lorna, I'd done the Buteyko, been on a Buteyko course, but not the full teacher training. But as a respiratory physio, I was looking into Buteyko. And this is about slowing your breathing right down, breathing low and slow, breathing nasally. And that time I was in Huddersfield Choral Society, and every 2 years we had to re-audition. Now, put me in a choir and sing, fine. Put me in front of 6, 10 people or whatever, singing on my own. That's scary. And so I realized when I was at home, I was sort of sighing or yawning, all the signs of sort of, not breathing correctly. And then I remember saying to myself, for goodness sake, Georgie, you work with people with hyperventilation, sort yourself out. And I remember for the 10-minute journey down for the audition, I just kept my mouth shut the whole way. And I just breathed really calmly. It was even in and out and just breathing rhythmically and calmly and slowly. And then while I was waiting to be called in, and I was the most calm I'd ever been singing in front of people before. I sang higher than I had ever sung before. And that the breathing was absolutely what helped me retain clarity, keep calm. And I think what happens is that people don't realize the power of breathing. And Susie's saying, is there a preferred time of day to do a daily practice? And I'll let you answer that, Lyndsey. As far as I'm concerned, it's little and often throughout the day, and absolutely do a 20-minute practice, but do not a particular time. But this is something that I practice it in my cold water tub in the morning. I have to, otherwise I'd be. But it is about breathing, just keeping calm and getting into a meditative state. So I think breathing is so much more powerful than people realize. No, I don't sing like a superstar, Susie, not at all. I don't even sing with them anymore. But the breathing is helpful if you sing anyway. So knowledge of breathing is really good. That can really help. But I think it can help us in so many different scenarios. So what would you say then, Lyndsey? Do you have a certain time of the day that you would practice breathing or recommend people breathe at a certain time of the day?
Yeah, as you said, I do suggest to people to do, make it manageable in small chunks, because if you give yourself a big period of time to do something, you're less likely to do it. But I think it depends on the sort of person you are. So for me personally, I'm a morning person. I get up really early. I like to come down and do a breathwork practice and a movement practice before I take the dogs out, and before I teach yoga myself. So I kind of feel set up for the day. If I'm short on time, I would prioritize breath work over movement personally, because I know I'm going to get loads of other movement during my day, doing lots of other things. So whereas I might not get many times just to sit down. So, but if you're, I've got students that I work with who are really they're just not morning people. They don't really get going until later in the day. They're much better functioning in the evening, and they find it works better for them to do things later in the day. And then certain people, particularly if it's people with insomnia, people who've got a lot of problems sleeping, I really suggest to them perhaps doing the breathwork practice sometimes as you go to bed, because it can be really helpful in getting you in that right sort of relaxed state for being more likely to go to sleep. And even if you don't go to sleep, you're more likely to be relaxed, which increases your chance subsequently of going to sleep. So it really depends, I suppose, kind of why you're looking to do it, how you live your life, and what kind of morning or evening person you are is what I would say. So it does have. And
also, it's like with anything that sometimes having a routine can be helpful, and you're more likely to actually do it if you set a certain time. But out of interest, when people are going to bed, presumably you are encouraging them to do the longer out breath when they're in bed.
For 8 rounds only still. I wouldn't be doing it constantly. It has a more negative impact if you carry on doing it. So I'd say 8 rounds of the longer exhale, and then I'd return back to coherent breathing all the time, and just stick with that. And try and do 15-20 minutes coherent breathing when you go to bed, and chances are you'll never finish the 15 or 20 minutes. You'll always fall asleep beforehand.
And like you say, for people who really do struggle with the lasting the sort of 5 or 6 counts in and out, start where you're at, and then just the calmer you're feeling, the easier it is to just slow yourself down as well. And it can take training.
I worked with my dad last year. He had COPD very badly and quite difficulty breathing, and we worked with coherent breathing for him, and we started on about 3-second inhale, 3-second exhale. We were able to actually get him up to 6-second inhale, 6-second exhale, and it actually had a really, really positive impact for him in terms of we would put an oximeter onto his finger and we'd measure the level of oxygen in his blood at the start of the practice, which would be very low, and his levels were around 85, 86, very low levels. And after 15 minutes of doing 15, 20 minutes of coherent breathing, we could get him up to closer to 90, low 90s sometimes. So we could see that it had an impact, and then it would stay a bit higher for quite a period of time afterwards. And so we probably worked over a couple of months to get him from 3 seconds up to 6 seconds. So even with people with very challenging breathing conditions typically can, although for some people it makes them feel anxious. So some of it's a mindset thing, and actually kind of going back and working with shorter periods of time again.
Yeah. Great. So Maggie's saying, when you start to look into breath work, there seem to be many techniques and approaches, absolutely, and I found it confusing. Is it just a case of finding what works for you, or any technique you particularly recommend? And again, I think there are so many, and certainly when we are teaching it, when we're doing it on our online program, it's just the basic nasal breathing, keeping it calm, keeping it relaxed, and coherent breathing, because I think both including those are really important. And yes, there's loads of YouTube videos and all sorts about breathing, but I think basically what you're saying, Lyndsey, is the main thing is the coherent breathing that you focus on.
Yeah, so from a yoga perspective, we're always teaching breathing in and out through the nose, unless there's a reason why you can't breathe in and out through the nose. So I think that's one thing, as Georgie says as well. And then a coherent breathing is easy and it's straightforward to do, and anyone can do it.
Yeah.
And so I'd say there are loads of other breathing techniques. So when I became when I used to practice yoga, and then when I became a yoga teacher, on my yoga teacher training, we probably learned about 10 different breathing techniques. I don't teach any of them now. I don't teach any of them at all. I just teach coherent breathing, and I teach one or two other practices, 4-7-8 sometimes, and sometimes 4-8 for 8 rounds. That's it, because it's just not necessary. It's not necessary to learn all these other ones or to practice all these other ones. I really strongly believe that just a straightforward, simple approach is like the things we do in life, isn't it? The simpler it is, the easier it is for us to do and learn, and to be able to do it on our own, so we don't have to have a video to watch, or there are some things, apps that can help you, because counting 6 seconds, you can add a count where you can come up with a phrase, like I said before, that can kind of roughly be at the right length. But there are apps now for everything, aren't there? So there's an I Breathe app, if you've got an iPhone, for example, which you can set just to come up with a little noise at each 6 seconds. There's the Insight Timer app, which has a timer where you can again set it to make a little chime every 6 seconds. There's loads of different things you can use which can help you, but you don't need anything complicated.
No. And they have the Heart Math app, don't they? The Inner Balance. And again, that's more about biofeedback, so you can see what's actually happening and how coherent you are. And for people who like techie stuff and like to get into that, then that could be nice to do. But it's, as you say, it's not necessary. And certainly when we were talking about the breathing, we've taught Heart Math breathing for a long time, and I do think it's just, there's so much evidence base behind it, and that plus nasal breathing, which are combined, then I think we don't need it any more than that, basically. And as Susie is saying, you have to breathe out through the mouth to relax. No, I mean, again, there's this when they talk about the if you take a deep breath in and hum or sigh out and vibrate the throat, you stimulate the vagus nerve. So that's maybe for 1 or 2 breaths. Some people like to do that. But on the whole, actually just breathing in and out through the mouth, through the nose rather, it's not necessary to breathe out through the mouth. No.
I agree with everything Georgie just said. Exactly. And
I just think that so many people are so busy thinking, I must do this strategy, that strategy, without realizing that this is something that we have, within us. It's such a simple way of affecting every system in our body. And yet often people don't remember that. that even though our breath changes so quickly when we're stressed, and therefore that's a clue straight away that, oh, okay, right, we can breathe. And many of us breathe dysfunctionally. So learning to do this, and even just doing it 2 minutes at a time as we gradually train ourselves to breathe more slowly and more coherently, then it can have such profound effects, can't it, Lyndsey, as you're finding through your work?
Well, people naturally often breathe very high up in the chest, as you've probably found with your work you've done, Georgie. And I know one of the things you do when you're working with patients is looking at observing where is the breath coming into the body. And it's something as a yoga teacher looking at as well, working with people one-to-one, or in therapeutic work with people, and trying to get people to breathe more deeply, diaphragmatic breathing all the way down into the belly, expanding the ribs properly. And it's amazing how many people don't. And then the speed of people's breath. So people breathing maybe 20 breaths per minute, and actually doing a 6-second inhale, 6-second exhale, it's 5 breaths per minute. And most people are breathing somewhere between 12 and 20 breaths a minute. Some people quicker, and so it has a fundamental, and so as a result, because they're breathing so fast, they can only breathe very shallowly into the chest, and because of that, they're not getting enough oxygen in, and it has all these knock-on effects from a health perspective.
So a lot more dysfunctional breathing around than I think anybody recognised. And certainly as a respiratory physio 30 plus years ago, we'd say, oh, it's normal. The normal breathing is sort of 14 breaths a minute. Not really realising that's fast. It is normal actually, but it shouldn't be normal. It's become the norm in this stressed world that we all live in, because breathing up here and fast is really, showing that we're in sympathetic dominance. In fight or flight.
Everyone's probably sat there now thinking, oh my God,
am I breathing?
Am I doing? Am I breathing all the way down into my belly?
I tell you what, it's just made me think though, Lyndsey, because you work online, don't you?
Yeah.
Would you like to finish this off with a breathing exercise? Would you be happy to do that?
Yeah, I'd be very happy to do that.
I presume everybody would be happy for you to do that. Lorna's saying, so Lorna also specializes in breathing. Dysfunctional breathing is very common in those with TMS, and I think it's just very common generally as well, but that's why it's good to work on breathing with all our patients. Maggie's up for it. I reckon everybody would be up for it, even though Caroline says yes. I think it'd be a lovely way to finish this session, because it's actually, we didn't start with it knowing we'd be talking about breathing predominantly, but it's a really important subject, and I think it'd be a lovely way to finish. We've got another 8 minutes, so are you happy to do that?
Absolutely, yeah. So everyone, just making sure you've got somewhere comfortable to sit, and you don't need to be sitting on the floor. You can be sitting in a chair. I would recommend sitting upright as opposed to lying down, although you can do this practice lying down if you want to, if you're more comfortable and want to lie on the floor. And just let the hands be relaxed on the thighs, let the shoulders relax. If you feel comfortable closing the eyes, feel free to do so, or you can just sort of take a downward gaze, just so you can bring the attention a little bit more inward. And then just start by bringing attention to your normal breath, just noticing where the breath's coming in the body. And seeing if it's possible, if you've not got a cold or any other restrictions, to breathe in and out through the nose. And over the course of the next few breaths, just see if it's possible to breathe a little bit more deeply down into the belly. And see if you can just notice the sensation of the belly starting to expand out on each inhale. And then the belly slowly relaxing, releasing, contracting on the exhale. But not controlling it in any way, just noticing it. I'm going to look to start to add a count to the breath. And I'm going to start with a count of 4. We'll be looking to do an inhale for 4 and an exhale for 4. If you find that a length of 4 seems too long or not right for you, then just return back to your normal breath at any point. Over the course of a few breaths, I'll increase the count to a count of 6. Again, if you find that the 6 is too long, go back to 4 or any other pattern of breathing that works for you. So on your next inhale, inhaling 1, 2, 3, 4, exhaling 2, 3, 4, inhaling 2, 3, 4, exhaling 2, 3, 4, inhaling 2, 3, 4, exhaling 2, 3, 4, inhaling 2, 3, 4, 5 now, exhaling 2, 3, 4, 5, inhaling 2, 3, 4, 5, exhaling 2, 3, 4, 5, inhaling 2, 3, 4, 5, exhaling 2, 3, 4, 5, inhaling 2, 3, 4, 5, 6 now, exhaling 2, 3, 4, 5, 6, inhaling 2, 3, 4, 5, 6, exhaling 2, 3, 4, 5, 6. Continuing, I'm going to add a little chime noise. You might just hear this little wooden block tapping noise. See if you can keep each inhale and each exhale, so every time you hear the block, you either exhale or inhale. Again, if you're finding this too long, the inhale in particular, just feel free at any point to return to a shorter length that works for you. If you find on the inhale that your breath sort of runs out before you get to the full 6 seconds, you can always just sort of hold the breath for 1 or 2 seconds before you exhale fully out. And if you're finding it comfortable breathing at this rhythm of 6-6, you could add in a visualization. You could imagine that with each inhalation, the breath moves from the base of the spine to the crown of the head. And on each exhalation, from the crown of the head to the base of the spine. Visualizing the breath moving from base of spine to crown of head on inhale, and from crown of head to base of spine on exhale. If you're someone who finds it hard to visualize, you might just think crown of head on the inhale, bring your attention there. And you might think base of spine on exhale and just bring the attention there. We'll continue for 1 more minute. And the next tap noise you hear will be the last one. So wherever you are in your breathing pattern, just whenever you're ready, returning to a normal breath that works for you. And just bring your awareness back to the room around you. If you've got the eyes closed, you could open the eyes. And just see how you feel after just a couple of minutes of coherent breathing. You might feel the same. You might feel a bit calmer. It might be too much information all in one go. But you can see how it feels today. And maybe try it again another day. How did you find it, Georgie?
Lovely. I always find it just so lovely. It just centering me, calming me down. Mm-hmm. And like you say, just a few minutes even, and build up. If 20 minutes is what they're saying makes such a big difference, then absolutely, why wouldn't you want to build it up to that? But then another thing I recommend is just noticing off and on through the day, how are you breathing? Sometimes connecting it with something like every time you make a cup of coffee or sit on the loo or whatever, if you then notice how am I breathing, it's like a reminder, isn't it? To, okay, calm the breathing down, even if it's just for a few breaths before you then move on. It's like a pause in the day, isn't it?
But when people first start practicing yoga and they've never done any breathwork practices before, or they've not used to working with the breath in any way, give them a set of little stickers, little tiny stickers, them to put the stickers in places like on the steering wheel, on their toothbrush.
No, good idea.
And so every time they see a sticker, it reminds them to like stop and breathe fully.
Yeah, that's a good idea. Lovely idea. Well, thank you for doing that, Lyndsey. No, that was really good. Definitely worthwhile. And anybody listening to this later on can have a practice as well. So thank you for joining us, everybody. And thank you for all your questions as well. That's really helped us sort of focus on what I think is really, really important to understand. So thank you all for joining us.
Thanks a lot. Thanks, Georgie. Lovely to have all the questions.
Great. Thanks very much then, Lyndsey. Bye, everybody.